Affordable Care Act, we will be talking about none other than that pesky law that people keep complaining about, but which is actually such a great thing, called the Affordable Care Act. This is being presented by the Alabama Cooperative Extension System and the Tom Bigby Healthcare Authority. My name is Lydia Chapman. I am an Affordable Care Act navigator here in Dallas County. My office is located in the Alabama Cooperative Extension System building at 429 Lauderdale Street here in historic Selma, Alabama. I may be reached at 334-875-3200 or by email at lmc0040@auburn.edu. During this session, we will grow to understand how the Affordable Care Act is already helping and what's coming. We will also talk about new coverage options at the healthcare insurance marketplace, as well as how we can get enrollment help at healthcare.gov or by dialing 1-800-318-2596. And last but not least, we are all going to learn how to spread the word, make ourselves committees of one to let everyone know about the new coverage options available to us because of the Affordable Care Act. The first thing we have to make sure that you understand is that the Affordable Care Act is not free health insurance. I know a lot of people refer to it as Obamacare, but it is not in the same vein as Medicare and Medicaid. It is not a free health insurance, but rather the Affordable Care Act allows Americans, millions of Americans, access to affordable health care insurance. Do you have to have health insurance? Absolutely. In 2014, everyone must have health care insurance or pay a penalty. If you are already covered, your plan may be based on your job. You may have Medicare, Medicaid, participate in the Children's Health Insurance Program, or TRICARE, or any Veterans Health Care Program. You will probably already be considered covered. But if you do not have any of these type plans available to you, you will certainly need to enroll in the marketplace located at healthcare.gov or be ready to pay a penalty in 2015 when you go to file your federal income taxes. So if you already have insurance, how is the Affordable Care Act helping you? The first thing is a patient choice of doctor. Because of the Affordable Care Act, we as patients now have the choice. We have options to be able to choose what physicians we want to go to. Also, for ladies, obstetrics and gynecological visits are available without referral, which means that our general health physician does not have to refer us to an OBGYN specialist, but rather we can go on our own and receive that care because of the Affordable Care Act. There is also no more pre-existing condition exclusions for children. In years past, children suffering from chronic illnesses or those that may have developed illnesses after birth had been allowed or basically pushed off of insurance based on the fact that it was costing the insurance company lots of money. But day one of the Affordable Care Act and its enactment, there were no longer any allowances for healthcare insurance providers to push babies off of healthcare insurance. So therefore, no more pre-existing condition exclusions exist ever for any healthcare insurance provider for children. Also, young adults can now stay on parents' insurance plans until you're the age of 26. That is across the board. Free preventative care, as well as more affordable prescription drugs for seniors is also something that is now in place because of the Affordable Care Act. No more lifetime benefit caps, and a phased-in ban on annual caps is also in place because of the Affordable Care Act. A lifetime benefit cap used to allow insurance companies for those individuals who may, as a child, or as a young adult, have experienced some illness that required a high level of medical supervision, and then years later, 10, 20 years later, had a bout with a different illness. There literally were people laying in hospital beds that received letters from their insurance provider saying that, okay, well, you've reached your lifetime benefit cap. We can no longer provide the financial benefit of covering your medical care. That is something that is non-existent anymore because of the Affordable Care Act. And there's also, again, that phased-in ban on annual caps. Hospitals are now more accountable to us, their communities. Hospitals are an important part of our communities, but they need us just as much as we need them. And so now, because of the Affordable Care Act, hospitals are now being held more accountable to us, the community members. Now, the asterisk that you see on some of these policies on the issue of patient choice of doctor, OBGYN visits without referral, pre-preventative care, and no more lifetime benefit caps or phasing ban on annual caps, some plans have been grandfathered in and are currently excluded from being compliant with the Affordable Care Act, but change will eventually come. But there are some plans, again, that have been grandfathered in. They are still considered or will allow you to be considered covered as far as the Affordable Care Act is concerned at this point. But yeah, they will definitely have to change as the law and more aspects of the law come into effect. In 2014, this year, there are no more pre-existing condition exclusions for adults. So that means everyone, children and adults, can no longer be kicked off of insurance policies because of pre-existing conditions. There's also no more annual benefit limits, and there is a cap on out-of-pocket costs. On annual out-of-pocket costs, there is a cap every single year, and it has been lowered actually for individuals who have been purchasing individual policies from healthcare insurance providers. It is a great thing to know that now there's a limit to where healthcare insurance providers can force you to have out-of-pocket expenses. And last but not least, in 2014, most Americans must either have healthcare insurance or pay a penalty to cover their uninsured care. The 10 essential health benefits made possible because of the Affordable Care Act include ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance abuse services, prescription drugs, rehabilitative services and devices, laboratory services, preventative and wellness services, as well as chronic disease management, and last but not least, pediatric oral and vision care. These Big 10 benefits, again, are all made possible because of the Affordable Care Act. These are the essential health benefits that must be included in any health care insurance policy that is available through the marketplace. So now, what is this health care insurance marketplace? The health insurance marketplace is a new way for individuals and families to shop for, compare, and purchase health care insurance. The plans are separated into 4 categories: bronze, silver, gold, and platinum. The levels of coverage range from bronze to platinum according to the expense of the premium. So your bronze plans, as we move across this chart here, the bronze plans have a lower premium or the lowest premium available, and the plan on average covers about 60% of the average cost of care. We, the enrollees, would pay on average 40% of the average cost of care. With a silver plan, which has a moderate premium, the plan would pay about 70%, and we would be left with about 30%. For a gold plan, which has a slightly higher premium, the plan would pay on average about 80% of the total average cost of care, while we would be left with 20%. And with platinums having the highest premium, the plan covers the highest percentage, that being 90%, and we are left with only 10%. And that is us paying that in addition to the monthly premium plan. This 10%, the 20, the 30, the 40 that enrollees are left with would basically include things like the deductibles. Who can buy health coverage in the marketplace? Anyone who currently buys health insurance on their own can certainly buy it through the marketplace. If you meet certain income requirements, you will be able to purchase insurance through the healthcare insurance marketplace. For example, if your current plan costs more than 8% of your family income or 9.5% of your annual income if your coverage is job-based, You cannot qualify for affordable job-based health coverage. If you cannot qualify for affordable job-based health coverage, then that means you can apply for health coverage through the marketplace. Please note that if you do not file income taxes or will not file in 2015 with the IRS, the government will be unable to offer subsidies to lower the cost of your premium. That stated simply means if you do not work, or if you work and do not earn enough to file your income taxes with the federal government, there is no way for the government to, there's currently no way for the government to offer subsidies to lower the cost of your monthly premium. So if you run into someone that said, hey, I enrolled in the marketplace and my premium is only $17 a month, then that means that person's income qualified them for subsidies or qualified them for tax credits that lowered their premium to only $17 a month. But that cannot be the case if you do not file income taxes. So just how affordable is affordable health care insurance? In the marketplace, you will get a discount on insurance premiums if you make under 400% of the poverty level. So basically, if you earn around $46,000 a year for an individual, or $94,000 a year for a family of 4, if you earn less than that, then you should be eligible for some sort of discount on your insurance premium. Now, I will caution to say that in the state of Alabama, we have not opted to expand Medicaid. So the actual limits look a little bit different, or where discounts are available looks a little bit different than just less than $46,000. We'll discuss that in a couple of future slides. There will also, though, be limits on out-of-pocket expenses such as deductibles, co-pays, and prescription drug costs. So here, who will get those lowered premiums? In the state of Alabama, those who are eligible for premium help include individuals with a family size of 1, whose household income is between $11,490 and $45,960. For a family size of 4, household income of $23,550 up to $94,200 per year. Who's eligible for cost sharing help? Family size of 1, again, that $11,490, but anyone whose income is between $11,490 and $28,725 should be found eligible for cost sharing assistance. For a family size of 4, $23,550 to $58,875 would be the annual household income that would qualify a family for cost sharing help. Now, what does this mean in plain terms? In plain terms, that means for an individual in the state of Alabama who logs on to healthcare.gov, whose income is family size of 1 and their income is less than $11,490, chances are you will be found to be, by the marketplace, to be Medicaid eligible. But because the state of Alabama did not expand Medicaid, you will need to either apply for an exemption, and that is especially for those of us that are looking for jobs that are working, but we earn less than that $11,490. We need to file for an exemption. If you do not file for an exemption, when you go to file your income taxes in January of 2015, you will be penalized. This year, or for next year, the penalty is only $95, or 1% of your annual income. That amount increases as the years go by. So I strongly encourage everyone, whether you are working or not, to enter the marketplace. You never know. You may have just met your new supervisor. You don't know when the job is around the corner. If you have at all been applying for a job, please enter the marketplace and make sure that you complete your exemption application, which can be printed off of healthcare.gov, and move forward with your life. And once you become employed and you go to file your taxes in January of 2015, you'll be able to present the certificate that the marketplace will mail you and therefore you will not be penalized on your federal income taxes. If you or someone you know has children who participate in the All Kids program, you are in luck. You or someone you know are in very good company and in luck because their income falls right within the range of being eligible for tax credits. According to the All Kids website, the graphic here you see on the right-hand side of the screen comes from the All Kids website. And these are the monthly gross income guidelines for the All Kids program. Now, these numbers are broken down according to the monthly income, but in the slide we just saw 2 pages back is per year. But when we do the math, parents who have children enrolled in All Kids are certainly falling right within the guidelines for being eligible for premium discounts in the marketplace. So, the income requirements for all kids fall within the income requirements for marketplace premium discounts or tax credits. At the marketplace, all kids parents can qualify for affordable health care insurance for themselves. This is really good news, and it's time for us to spread the word. As I talked about in a couple of slides back, if you are not earning at least $11,490 a year, you will technically still not have coverage. If you have no intention of filing your federal income taxes, then you do not need to worry. You will not be non-compliant with the Affordable Care Act if you do not move forward in submitting an application to the marketplace. However, if you are currently unemployed or you are a low-wage worker earning less than $11,490 per year, if you are a working parent earning less than that $11,490 a year, or a veteran, you are falling into what has been called the Alabama Medicaid gap. In many states, Medicaid has expanded to cover low-income adults. Governor Bentley has currently opted out of expanding Medicaid in the state of Alabama, which is leaving thousands of people without health care insurance. All uninsured Alabamians do need to apply for coverage in the marketplace to learn what's available for you. There are still relatively affordable plans available, and there's still great reason for you to apply even if you are currently unemployed. One of the major reasons why you should still apply is the fact that you never know when you may be called to work. And I would hate to see anyone face a penalty, a tax penalty, just because they didn't want to complete the application at a time during open enrollment and at a time when they were unemployed. A second big reason why you should go ahead and log on to healthcare.gov to complete your marketplace application is so that you no longer are considered just a number, but you are a real person in the state of Alabama who would literally have high-quality health care insurance if the Medicaid system was expanded in the state of Alabama. So this is still, entering your application in the marketplace is still your opportunity to express yourself, to put yourself out there and say, listen, I want affordable health care coverage. I cannot afford what the insurance providers are presenting me with, but I still want to be a healthy person living in the state of Alabama. So please log on or call and make sure that you get your application in, even if you feel that your income will put you in what is being called the Alabama Medicaid gap. Can you still buy health care insurance outside of the marketplace? Absolutely. You can certainly buy directly from an insurance company, or you can use your job-based insurance. But please note that any insurance you select outside of the marketplace must meet the Affordable Care guidelines in order for you to be considered as covered. So if you already have health care insurance, you can keep your coverage. There are some people that would love for you to think that the Affordable Care Act makes you lose the coverage that you're currently satisfied with. that is not the case. If you like your current coverage, you can keep it, but you are strongly encouraged to check to make sure that it meets the minimum requirements to avoid the tax penalty being imposed on you next year. What about people with Medicare? Medicare is not a part of the marketplace. So if you or someone you love is eligible for Medicare, it is going to be to their advantage or to your advantage in most cases to keep or sign up for Medicare. The Affordable Care Act did, however, strengthen Medicare benefits. Although Medicare and the marketplace are not the same, the Affordable Care Act did strengthen Medicare benefits by offering free preventative care. So things like colonoscopies and mammograms are now free for our elders who are taking advantage of Medicaid benefits, Medicare benefits. And as well as that donut hole, that pesky donut hole, by 2020, the Affordable Care Act should be able to reduce, if not eliminate, the donut hole, which will certainly lower prescription drug costs for those individuals on Medicare. Can you be denied coverage or charged more because of a pre-existing condition? Absolutely not. If there is one thing the Affordable Care Act did that was absolutely phenomenal, is it really allows everyone who wants health care coverage to get health care coverage. You cannot be denied coverage or charged more because you have a pre-existing condition. Diabetes, cancer, high blood pressure, HIV/AIDS, lupus, blood disorders. There's nothing that can prevent an healthcare insurance provider from covering you. You cannot be denied because of the Affordable Care Act. When can you sign up for coverage in the marketplace? Open enrollment started on October 1st of last year and will end this month, March 31st of 2014. If you buy your coverage by the 15th of the month, your coverage will be effective on the 1st of the next month. So that means if you purchase your coverage by the 15th of March, that means completing your application in the marketplace at healthcare.gov, going ahead and selecting a policy plan with whatever healthcare insurance provider available, and making your first premium payment by the 15th of March, your insurance coverage will kick in on April 1st. If you buy between the 16th and the 31st of March, your coverage will be effective on May 1st. So it will skip April but jump to May 1st. Your coverage will actually begin. How do you sign up for healthcare coverage in the marketplace? Log on to www.healthcare.gov and you can complete your application right there online. It's a very simple, straightforward process. If you have used online tax preparation services like TurboTax or FastTax, it's a very simple process, very similar to those services. So please log on to healthcare.gov and complete your application online. You may also call 1-800-318-2596 to complete your application over the phone. The customer service representatives working in the marketplace will walk you through the healthcare.gov questions over the phone. You will be able to hear your eligibility results. However, you will not receive them in the mail. But your follow-up is with the insurance company unless you are ready to enroll while you're on the phone with the customer service representative at the marketplace. While you can also submit a paper application, I strongly urge you to log on to healthcare.gov or to call 1-800-318-2596 to complete your application. It'll be a much faster process, and it helps to save some trees. Let's go green. You can, last but not least, you can get assistance with submitting your application from a local navigator. People like myself who are located across the country in each and every county and every state in the United States. You can contact your local navigator. There are also certified application counselors available or representatives with a federally qualified health center, a FQHC. Certified application counselors in Selma or in Dallas County are located I know there are some at Vaughn Regional. However, they are only servicing individuals who have been hospitalized or either currently hospitalized at Vaughn Regional or have been within the last 90 days. So if that's not you, they will refer you to me, Lydia Chapman, the local navigator, and my office is located at the Alabama Cooperative Extension System on Lauderdale Street. If you are ready to enroll or right before you get ready to start your enrollment process, make sure that you have this basic information in front of you. Things like the social security numbers of yourself and whomever else in your household will need coverage. You also may just want to have those numbers handy for those individuals who will not need coverage, but just to enter them in the application so that you are able to get a more accurate depiction of what the marketplace has available by way of healthcare benefits for you. You will also need any information that points to your income. So your employer's information, the address, telephone number, as well as income information. So that may be anything from paycheck stub or your tax returns. If you are self-employed, if you have receipts or invoices that indicate how much money you're earning per month, your 1099 forms, those are things that you need to have in front of you. If you or someone in your family is currently insured, you will need to have the current policy numbers in front of you as well as you complete your health care insurance application through the marketplace. You will also, if you are seeking insurance through the marketplace and are currently employed, but you feel that your insurance, or you know that your insurance is taking up more than 9.5%, and that is for individual coverage. If your individual job-based coverage is costing more than 9.5% of your annual income, you will need to have your Human Resources Department complete an employer coverage tool, which is a handout that can be printed off from healthcare.gov, and you will need to go ahead, have that completed, and be prepared to mail that into the marketplace. And last but not least, get familiar with basic insurance terms like premium, deductible, and copay. That is just going to be handy when you're talking to the insurance providers and seeking to learn more about the policies and what is available to you. Enrolling for coverage in the marketplace does continue after March 31st, but only if you have special qualifying life events like a marriage, a birth, job loss, or divorce. After March 31st, you must wait until the next open enrollment period to buy insurance, unless you have one of those qualifying life events. You can continue to enroll online, over the phone, or mail in a paper application. What do you do if you need help finding and choosing a health plan? You can seek the help or assistance of a navigator, a certified application counselor, an insurance agent, or representative at a federally qualified health center. Navigators are federally trained persons available in most communities who are able to assist you in your application process through healthcare.gov. You can locate your local navigator by visiting www.healthcare.gov. My name is Lydia Chapman, and I am a federally trained navigator in Dallas County here in Alabama, working at the Alabama Cooperative Extension System. I may be reached at 429 Lauderdale Street here in the historic city of Selma, Alabama. My number is 334-875-3200, and my email address is lmc0040@auburn.edu. Our office is open Monday through Friday from 8 a.m. until 4:30 p.m. We accept walk-ins. I am one of two navigators in the building, but I am probably going to be the person that you will be directed to based on the fact that the other navigator is the actual director of the entire Dallas County Extension Office. So, again, you can reach me by phone, by email, or just by dropping by. I do schedule 1 hour appointments to enroll people in the marketplace. Although my typical enrollment time is about 15 to 20 minutes, I do prefer to book in 1 hour appointments because you just never know when things may be a little bit more complicated. So if you give me a call Monday through Friday between 8 a.m. and 4:30 p.m., I will definitely be able to book an appointment for you. And if I'm not in the office, our receptionist is always ready and available to take your message. Where can you get more information? The Healthcare Insurance Marketplace in Alabama, you can give them a call at 1-800-318-2596. That is actually the national number to the marketplace. That is toll free. You can give them a call and they will certainly be able to assist you, answer any questions you may have, as well as assist you with your application over the phone. You may also choose to visit the marketplace website at www.healthcare.gov. And last but certainly not least, I'd love to see each and every one of you at the Dallas County office of the Alabama Cooperative Extension System. Again, my name is Lydia Chapman, and I am an Affordable Care Act navigator who may be reached at 334-875-3200. I thank you for your attention and hope you've had the opportunity to learn a lot.